Question 1. In a standard pharmacy refrigerator, where is the least appropriate place to store vaccines? A. On the top shelf. B. In the middle of a central shelf. C. In the door shelves. D. On the bottom shelf near the back. Answer: C. In the door shelves. This question tests knowledge of proper vaccine storage, a critical quality assurance task. The key phrase, least appropriate, points to the worst storage location. The refrigerator door is the worst place for vaccines because its temperature fluctuates the most every time it is opened and closed, which can damage sensitive biologics. For example, storing a flu vaccine in the door could expose it to warm air, reducing its effectiveness. Always remember to store vaccines and other sensitive medications in the main body of the refrigerator, away from the door, to ensure a stable temperature. Question 2. How should a patient be advised to store sublingual nitroglycerin tablets to maintain their potency? A. In a plastic weekly pill organizer. B. In their original, tightly capped amber glass container. C. In the refrigerator to keep them cool. D. On a sunny windowsill for easy access. Answer: B. In their original, a tightly capped amber glass container. This question assesses your knowledge of storage for a specific, highly sensitive medication. Nitroglycerin is extremely unstable and rapidly loses its effectiveness if exposed to heat, light, or air. Its original amber glass container is specifically designed to protect it from these elements. For instance, transferring the tablets to a common plastic pillbox would expose them to air and humidity, rendering them useless in an emergency. The key takeaway is that some drugs have very specific packaging for a reason, and nitroglycerin is a prime example where original packaging is required for stability. Question trivial. According to United States Pharmacopeia, USP, guidelines, what is the acceptable temperature range for medications that must be stored at controlled room temperature? A. 0 degrees Celsius to 10 degrees Celsius, 32 degrees Fahrenheit to 50 degrees Fahrenheit. B. 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. C. 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. D. Minus 25 degrees Celsius to minus 10 degrees Celsius, minus 13 degrees Fahrenheit to 14 degrees Fahrenheit. Answer: C. 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. This question tests your knowledge of official temperature definitions set by the USP. The term controlled room temperature is a specific standard, not just any ambient temperature. It is defined as a temperature maintained thermostatically between 20 degrees Celsius and 25 degrees Celsius, 68 degrees Fahrenheit and 77 degrees Fahrenheit. Storing medications outside this range, for example in a hot car or a cold garage, can cause them to break down and lose effectiveness. Always remember that controlled room temperature is a precise range to ensure the medication remains stable until its expiration date. Question 4. What is the maximum beyond use date, BUD, for a multi-dose vial, e.g., insulin, some vaccines, after it has been opened or punctured, unless specified otherwise by the manufacturer? A. 7 days. B. 14 days. C. 28 days. D. 90 days. Answer: C. 28 days. This question relates to the stability and sterility of injectable medications after their seal has been broken. A multi-dose vial is the key term, indicating a container intended for multiple entries. Once a needle punctures the rubber stopper, the risk of contamination begins, so a beyond-use date is assigned, which is typically 28 days. For example, an opened vial of insulin is generally discarded after 28 days, even if there is medication left and it's within the manufacturer's expiration date, Think of the 28-day rule as a safety clock that starts ticking as soon as a multi-dose vial is first used. Question 5. Why are certain medications, such as doxycycline and furosemide, dispensed in amber-colored vials? A. To indicate the medication is a controlled substance. B. To protect the medication from degradation by light. C. To make the vial easier for patients to grip. D. To prevent the medication from freezing. Answer: B. To protect the medication from degradation by light. This question focuses on photostability, which is how light affects a drug. The key clue, amber-colored vials, is the standard pharmaceutical method for protecting light-sensitive medications. This special color filters out harmful ultraviolet, UV, light that can cause a chemical reaction called photolysis, breaking down the active ingredient and making the drug less effective or even toxic. A good rule of thumb to remember is that if a drug comes from the manufacturer in an amber container or is dispensed in one, it must be protected from light. Question 6. What is the most common chemical degradation pathway for drugs, which is often accelerated by the presence of water or moisture? A. Oxidation. B. Photolysis. C. Hydrolysis. D. Decarboxylation. Answer: C. Hydrolysis. This question tests your understanding of the different ways drugs can chemically break down. The keyword here is water or moisture, which directly points to hydrolysis. Hydrolysis is a chemical reaction where water breaks down the bonds of another compound, and it is the single most common cause of drug degradation. For example, aspirin is highly susceptible to hydrolysis. If stored in a humid bathroom, it can break down into salicylic acid and acetic acid, causing stomach irritation. Remembering that hydro means water will help you link moisture with hydrolysis as the top cause of drug instability. Question 7. The storage instruction, protect from freezing, is critically important for certain medications, such as insulin and many vaccines, because freezing can A. Cause the medication to become a controlled substance. B. Irreversibly damage the drug's molecular structure. C. Make the drug container brittle and likely to shatter. D. Concentrate the active ingredient, causing an overdose. Answer: B. Irreversibly damage the drug's molecular structure. This question is about understanding the physical stability of complex drugs. The instruction, protect from freezing, is a critical warning, especially for biologics like proteins and vaccines. When these complex molecules freeze, the formation of ice crystals can physically destroy their delicate three-dimensional structure, a process called denaturation, rendering them permanently ineffective. For example, a vial of insulin that has frozen and then thawed must be discarded because the insulin protein is damaged and will no longer work correctly. Think of it like freezing an egg. You can't unscramble it back to its original liquid state after it's been cooked, and the same concept applies here. Question 8. Under USP less than 795, what is the maximum beyond use date, BUD, for a water-containing topical/dermal formulation, such as a cream or lotion? A. 14 days. B. 30 days. C. 6 months. D. 1 year. Answer: B. 30 days. This question tests your knowledge of beyond-use dates, BUDs, for non-sterile compounded medications. The key phrases are water-containing topical and USP less than 795, which provide the specific context. For topical formulations like creams and lotions that contain water, the USP sets a default BUD of 30 days because water can support microbial growth over time. For example, if you compound a custom moisturizing cream with water as a base, you must label it to be discarded after 30 days to ensure safety and stability. A simple way to remember is that water-based topicals get about a month before they are considered potentially unstable or contaminated. Question 9. Which USP chapter provides standards for the handling, storage, and disposal of hazardous drugs in healthcare settings? A. USP less than 795. B. USP less than 797. C. USP less than 800. D. USP less than 825. Answer: C. USP less than 800. This question tests your ability to identify the correct USP chapter for a specific area of pharmacy practice. The key term, hazardous drugs, directly corresponds to the scope of USP chapter less than 800. This chapter establishes safety standards for personnel and the environment, including requirements for proper storage, such as keeping hazardous drugs in a separate, negative pressure room. For example, chemotherapy agents like methotrexate must be stored according to USP less than 800 guidelines to prevent accidental exposure. An easy way to remember is to associate 800 with the most serious category of drugs that require the highest level of handling precautions. Question 10. What is the appropriate temperature range for medications that require refrigeration? A. -5 degrees Celsius to 0 degrees Celsius, 23 degrees Fahrenheit to 32 degrees Fahrenheit. B. 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. C. 8 degrees Celsius to 15 degrees Celsius, 46 degrees Fahrenheit to 59 degrees Fahrenheit. D. 15 degrees Celsius to 20 degrees Celsius, 59 degrees Fahrenheit to 68 degrees Fahrenheit. Answer: B. 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. This question assesses your knowledge of standard pharmaceutical storage conditions. The term refrigeration has a very specific temperature range in a pharmacy setting to ensure drug stability. The universally accepted range is 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit, which keeps medications cool without freezing them. Many common drugs, such as most insulins, vaccines, and some liquid antibiotics, must be kept in this range to maintain their effectiveness. Always remember this specific range, as it is a fundamental piece of information for safely managing a pharmacy's inventory. Question 11. What is the primary purpose of running a horizontal laminar flow hood for at least 30 minutes before compounding any sterile products? A. To warm up the internal motor. B. To remove dust and airborne particles from the work area. C. To sterilize the surfaces with heat. D. To charge the HEPA filter with static electricity. Answer: B. To remove dust and airborne particles from the work area. This question is about maintaining a sterile environment, which is crucial for the stability and safety of compounded sterile products, CSPs. The key action, running a laminar flow hood before use, is a required procedure to create an ISO Class 5 clean air environment. The hood's HEPA filter continuously pushes clean air across the work surface, and running it for a period of time, typically 30 minutes, is necessary to clear any contaminants that settled while it was off. This ensures that when you begin compounding in 4-bag, for instance, the product is not exposed to bacteria or particles. Think of it as airing out a room, but on a microscopic level to achieve near-perfect cleanliness. Question 12. The management of temperature-sensitive products throughout the shipping and delivery process is known as A. Inventory control. B. Reverse distribution. C. Cold chain management. D. Hazardous material handling. Answer: C. Cold chain management. This question is about the logistics of transporting temperature-sensitive medications. The phrase temperature-sensitive products throughout the shipping process is the definition of cold chain management. This process involves using special packaging, such as insulated containers with gel packs, and temperature monitoring devices to ensure a product stays within its required temperature range from the manufacturer to the pharmacy. For instance, shipping specialty biologic drugs or vaccines requires a validated cold chain to guarantee they don't get too hot or too cold and lose their potency. The term cold chain is a great reminder that the link of proper temperature must not be broken at any point. Question 13. Why are many biologic drugs, such as monoclonal antibodies, particularly sensitive to improper storage temperatures and agitation? A. They are classified as controlled substances. B. They contain live viruses that can be deactivated. C. They are complex proteins that can easily be denatured. D. They are formulated in an oil base that can separate. Answer: C. They are complex proteins that can easily be denatured. This question tests your understanding of why a specific drug class, biologics, requires careful handling. The keywords biologic drugs and sensitive point toward their unique composition. Unlike simple chemical drugs, biologics are large, complex proteins with a specific three-dimensional shape that is essential for their function, and this shape can be irreversibly damaged, denatured, by heat, freezing, or even vigorous shaking. For example, a medication like adalimumab, Humira, can become ineffective if its protein structure is altered by being left in a hot car. Remember that biologics are like delicate, intricate machines, and improper handling can easily break them. Question 14. After a powdered antibiotic, such as amoxicillin suspension, is reconstituted with water, its stability changes significantly, resulting in a need for A. A new DA classification. B. Storage at controlled room temperature. C. A short beyond use date and refrigeration. D. Dispensing in an amber-colored bottle. Answer: C. A short beyond use date and refrigeration. This question focuses on the stability of drugs after they are mixed or reconstituted. Once water is added to the powder, the antibiotic begins to degrade via hydrolysis, which is why it is kept as a powder until it's ready to be dispensed. This chemical instability means the mixed liquid medication has a very short shelf life, or beyond use date, BUD, often just 10 to 14 days, and typically requires refrigeration to slow the degradation process. For instance, a bottle of reconstituted amoxicillin suspension must be labeled with refrigerate and discard after 14 days. Always remember that adding liquid to a powder antibiotic starts a countdown on its stability. Question 15. What is the primary purpose of maintaining a daily temperature log for a pharmacy's medication refrigerator? A. To record the times the refrigerator door is opened. B. To ensure compliance with manufacturer storage requirements. C. To track the inventory levels of refrigerated drugs. D. To schedule routine maintenance and cleaning. Answer: B. To ensure compliance with manufacturer storage requirements. This question is about quality assurance and documentation in the pharmacy. The keyword primary purpose asks for the main reason for this daily task. A temperature log provides a continuous, documented record that proves medications have been stored within their required temperature range, ensuring their stability and efficacy. For example, if a health inspector or accrediting body visits, the log serves as evidence that the pharmacy is following proper storage protocols for sensitive drugs like vaccines and insulin. Think of the temperature log as the refrigerator's report card, showing it has consistently maintained a safe environment for the drugs inside. Question 16. Under DEA regulations, how must Schedule II controlled substances be stored in a pharmacy? A. On a separate shelf from other medications in the main pharmacy. B. In a securely locked, substantially constructed cabinet or vault. C. Dispersed throughout the regular stock of non-controlled drugs. D. In the pharmacy refrigerator, regardless of temperature requirements. Answer: B. In a securely locked, substantially constructed cabinet or vault. This question tests your knowledge of federal law regarding the storage of high-risk medications. The keyword is Schedule 2, which refers to drugs with a high potential for abuse, requiring the most stringent security measures. DEA regulations mandate that these substances must be stored in a safe, vault, or steel cabinet that is securely locked to prevent diversion. For example, medications like oxycodone or fentanyl must be kept under lock and key, with access strictly limited to authorized personnel. An easy way to remember this is, the higher the risk of abuse, like with CIIs, the higher the level of security required. Question 17. A patient brings in a vial of insulin that was left in their car on a hot day. The insulin now appears cloudy when it should be clear. What is the correct action? A. Tell the patient to shake the vial vigorously to mix it back together. B. Advise the patient that the insulin is likely damaged and should be discarded. C. Instruct the patient to refrigerate the vial until it becomes clear again. D. Filter the insulin with a sterile filter before use. Answer: B. Advise the patient that the insulin is likely damaged and should be discarded. This question assesses critical thinking about drug stability and patient safety. The clues hot day and cloudy when it should be clear are strong indicators that the insulin, which is a protein, has been denatured by heat. Heat damage to insulin is irreversible and makes the drug ineffective and unsafe to use. Attempting to cool it down or shake it will not restore its proper molecular structure. The only safe course of action is to advise the patient to discard the vial and obtain a new one. Remember the rule for sensitive biologics: when in doubt, throw it out. Question 18. What is a key requirement for the final disposal of an expired or unwanted controlled substance from a pharmacy's inventory? A. It must be returned to the patient who originally received it. B. It must be flushed down the toilet to prevent diversion. C. It must be rendered non-retrievable and its disposal documented. D. It can be thrown in the regular trash if mixed with coffee grounds. Answer: C. It must be rendered non-retrievable and its disposal documented. This question addresses the legal and safety protocols for controlled substance disposal. The term non-retrievable is a specific DEA requirement, meaning the substance must be physically or chemically altered to a state where it cannot be recovered or abused. This process must also be formally documented, often with a witness, to maintain a clear chain of custody and prevent diversion. For instance, using a chemical denaturing kit to destroy expired morphine tablets is a proper method. Always remember that destroying controlled substances is a formal, documented process designed to make them permanently unusable. Question 19. According to USP less than 800, where should hazardous drugs, HDs, be stored within the pharmacy? A. In a separate area with negative pressure to contain any airborne particles. B. On the lowest shelves to minimize the risk of spills from a high place. C. In the main drug storage area, but with bright yellow warning labels. D. In the refrigerator, mixed with other temperature-sensitive medications. Answer: A. In a separate area with negative pressure to contain any airborne particles. This question tests your knowledge of specific storage requirements for dangerous medications. The key terms hazardous drugs and USP less than 800 point to regulations designed to protect healthcare workers. USP less than 800 mandates that HDs must be stored separately from non-hazardous stock in an area that has negative pressure, which means air flows into the room and is vented outside, preventing toxic particles from escaping into the main pharmacy. For example, antineoplastic, chemotherapy, drugs must be kept in a designated negative pressure room. The core principle to remember is containment. Hazardous drug storage is all about keeping the danger locked away. Question 20. According to USP less than 795 guidelines, what is the default beyond use date, BUD, for a compounded non-aqueous formulation, such as an ointment or suppository? A. 14 days. B. 30 days. C. 6 months. D. 24 hours. Answer: C. 6 months. This question is about assigning a beyond use date, BUD, for a specific type of compounded product. The key terms are non-aqueous formulation, which means a product containing no water, and USP less than 795, the chapter for non-sterile compounding. Since there is no water, the risk of microbial growth is very low, allowing for a much longer BUD. The default guideline is 6 months or the earliest expiration date of any ingredient used, whichever is shorter. For example, if you compound a magic mouthwash without any water, it can be assigned a 6-month BUD. Just remember, no water means low risk and a longer BUD. Question 21. What is the fundamental difference between a manufacturer's expiration date and a beyond use date, BUD? A. The expiration date is for sterile products, while the BUD is for non-sterile products. B. The expiration date is set by the manufacturer for an unopened product, while the BUD is assigned by the pharmacy for a manipulated product. C. The BUD is always longer than the manufacturer's expiration date. D. The expiration date is a recommendation, while the BUD is a legal requirement. Answer: B. The expiration date is set by the manufacturer for an unopened product, while the BUD is assigned by the pharmacy for a manipulated product. This question tests your understanding of two critical dating concepts in pharmacy. The manufacturer's expiration date applies to the original, sealed container and is based on extensive stability testing. A beyond use date, BUD, is assigned by the pharmacy after a product has been opened, mixed, or repackaged, reflecting its stability in the new container or formulation. For example, a bottle of amoxicillin powder may have an expiration date 2 years away, but once reconstituted with water, the pharmacy must place a 14-day BUD on it. The key takeaway is that expiration dates are for untouched products, while BUDs are for products the pharmacy has altered. Question 22. What is the primary function of a desiccant canister or packet placed inside a stock bottle of medication? A. To absorb moisture and prevent hydrolysis. B. To release a pleasant aroma when the bottle is opened. C. To absorb oxygen and prevent oxidation. D. To act as a rattle to mix the tablets when shaken. Answer: A. To absorb moisture and prevent hydrolysis. This question is about the role of excipients and packaging components in maintaining drug stability. A desiccant is a substance specifically designed to absorb water vapor from the air. This is crucial for medications that are sensitive to moisture, as it prevents hydrolysis, a common chemical reaction where water breaks down the active ingredient. For instance, some HIV medications and diagnostic test strips are packaged with desiccants to keep them dry and effective. Just remember that desiccants are like tiny sponges that soak up humidity to protect the drug. Question 23. According to USP less than 795 guidelines, what is the maximum beyond use date, BUD, for a water-containing oral formulation, such as a reconstituted antibiotic suspension? A. 24 hours. B. 14 days when stored at a cold temperature. C. 30 days when stored at room temperature. D. 6 months. Answer: B. 14 days when stored at a cold temperature. This question tests knowledge of beyond use dates, BUDs, for compounded oral liquids. The key terms water-containing oral formulation and USP less than 795 set the specific guidelines you need to follow. Because water can support the growth of microorganisms and promote drug degradation, the stability of such formulations is limited. The standard USP guideline for these products is a BUD of no later than 14 days when stored in a refrigerator. For example, A magic mouthwash prepared with nystatin suspension must be labeled with a 14-day BUD and a refrigerate auxiliary label. Question 24. A drug label states, store at 20 to 25 degrees Celsius, 68 to 77 degrees Fahrenheit, excursions permitted to 15 to 30 degrees Celsius, 59 to 86 degrees Fahrenheit. This indicates the drug should be stored at A. Refrigerated temperature. B. Controlled room temperature. C. A cool place. D. Frozen temperature. Answer: B. Controlled room temperature. This question tests your ability to interpret official drug storage language found on a manufacturer's label. The specific range of 20 to 25 degrees Celsius is the United States Pharmacopoeia, USP, definition of controlled room temperature. The excursions permitted clause allows for brief deviations from this range, such as during shipping, but the primary storage condition should be within the main range. This ensures the drug maintains its stability and potency over its shelf life. Think of the 20 to 25 degrees Celsius range as the ideal home temperature for the majority of medications that don't require refrigeration. Question 25. Oxidation is a chemical degradation process that can be minimized by packaging a drug. A. With a desiccant to absorb moisture. B. In an amber vial to block light. C. In a container with minimal air or with an antioxidant. D. With a child-resistant cap. Answer: C. In a container with minimal air or with an antioxidant. This question tests your knowledge of a specific type of drug degradation and how to prevent it. Oxidation is a chemical reaction that involves the loss of electrons, often triggered by exposure to oxygen, air. To protect drugs sensitive to this process, manufacturers may use packaging techniques like flushing the container with an inert gas, like nitrogen, to remove air or adding a preservative called an antioxidant to the formulation. For example, epinephrine is highly susceptible to oxidation, which is why it is often packaged with an antioxidant to maintain its stability. A simple tip is to connect the oxidation with oxygen, reminding you that limiting air exposure is the key.